What can cause maggots to come out of your booty? Asking for a friend. Sunburn eyeballs, the supposed most painful way to die, and what the heck is blue lung? Today, we're going down the internet's strangest medical rabbit holes, from hot tub STIs to do elephants hold some secret medical cure. These are the most thought-provoking health questions on the internet. Let's dive right in. First question, can you get STIs from a hot tub, or does chlorine wreck that idea? So STIs, right, it's sexually transmitted infections. It's out there. You hear it all the time, but it's pretty much a myth that you can get an STI from a hot tub. STIs need the right environment for them to survive and transmit. Typically, you get an STI from sexual interaction or sharing of bodily fluids. If a hot tub is maintained properly, viruses and bacteria don't survive well in that. So just to reiterate, STIs equal STDs. We just changed the terminology. All lead to a type of infection. We just changed it to make it more accurate. So an STD is now referred to as an STI. Is it true people can smell rain a lot more than sharks can smell blood?
Ooh, that's good.
Humans' smell sensitivity is pretty impressive, and more than I would have even thought. We have the ability to smell rain really well because of something called petrichor. Comes from the oils and the soil bacteria that are released in the air and that we are able to detect. In parts per trillion, we as humans are so sensitive to being able to pick up when rain is going to happen. We're really good at it, but we don't believe in ourselves, or we don't trust our smell. Sharks, on the other hand, are great sniffers, especially of blood, but not to the extent that we see in movies where they can get a drop of blood from all the way across the ocean to come get you. No. So most sharks can detect blood in 1 part per 10 billion. In real world conditions, what does that mean? That means that a shark could smell blood a couple 100 meters away. They're better sniffers of blood than humans. We can smell a little bit. A teaspoon that's close to us is the iron, like the heme products. It's more of a metallic smell that we actually can smell. I can tell you at the hospital, if there's blood on the ground in a room, you can smell it, or if there's blood, but you're not smelling it across in the parking lot. How good is your sniffer? I mean, how good is your smell? Are you good at smelling things, or do people say, oh, you smell this and you can't smell it? Let me know in the comments. Is it possible to sunburn our eyes? Yes. Oh, it's awful. It is painful, super uncomfortable. What is actually happening? So the UV light hits the eyes. The cornea is where all the nerve cells are of the eye. It's covering colored part of our eye, the iris plus the pupil, and it's clear cells that are there. And so when we get UV exposure, being out at the beach or skiing, it can damage that area, causing almost a burn. This typically from the sun is called photokeratitis. And what ends up happening is pain, blurry vision, itching of your eye, irritation, excess tearing. You have exposure, but then it takes multiple hours for it to kick in. So all of a sudden now you have this pain of your eye. Every time you blink your eyes, it hurts because there's inflammation and you're moving cells and sloughing cells off. Uncomfortable. So make sure when you're out in the sun, you're wearing protective lenses, right? Sunglasses. What can cause maggots to come out of your booty? Asking for a friend. It sounds like a horror movie. You're getting bugs coming out your rear end. A lot of times, different actual parasites and bugs can come out, but when it comes to maggots, you're thinking intestinal myiasis. And so usually what ends up happening, the egg end up on your food, not cooked properly, you ingest it in your body, acid in your stomach doesn't break it down, and basically they flourish inside your intestines, and then they eventually make their way out. Now there are other bugs that do come out, like pinworms. Those are bugs that hang out around the butt. We'll also have different type of helminths, which are different types of roundworms hang out in the intestine. So lots of different types of things that try to live within us, but there are medications that we do have to help kill them and get them out of our bodies. Can a woman actually be allergic to semen, or did someone just tell me that?
Is that a hair gel?
Actually, yes, you can be allergic to semen. It's actually called seminal plasma hypersensitivity, and it's just like any other type of hypersensitivity reaction. You're exposed to it. It's a protein within the semen that you're sensitive to. The body reacts with redness, irritation, itching, swelling, sometimes hives, sometimes more systemic reactions. But what could you do? You're treating it with the normal medications, antihistamines, and if significantly worse symptoms, you might need epinephrine. But this is actually true. It is rare, so people don't just make that up. Imagine being allergic to your partner. I've heard elephants almost never get cancer. Why is that? And do you think humans could learn from that and maybe apply it during things like chemotherapy? So that's really good. Elephants have a gene called TP53 and have about 20 copies of it. And this is actually called the guardian of your genome. Basically, it could be one of the many reasons why elephants have a really low incidence of cancer. We as humans have one copy of this gene. In China, they've come up with a medication. They've tried to use elephant TP53, but it hasn't worked. But they've also found that if you turn up our own P53 gene too much, it actually causes tissue damage in our own body where your cells are made, so you don't want to do that. So it is quite tricky to try to figure this out, but it is really good and cool to find other species that have these amazing adaptations that we can potentially learn from and use as humans. Is it true that if you are allergic to dust, that you are probably allergic to snails?
Are you allergic to seafood?
Actually, there's some truth to that. So dust mite allergies are linked to shellfish allergies, including shrimp, crab, and even snails. And it's because they share a similar protein called tropomyosin. So then there's almost like a cross reaction to this. That's why they say if you're allergic to, say, dust mites or you're allergic to shrimp, it might go back and forth. But to follow it up, not everybody who's allergic to dust is allergic to shellfish, and vice versa. What is the most painful way to die? Well, pain is very subjective and individuals' pain tolerances are all different. But rabies, you experience spasms, hallucinations, hydrophobia, you're not eating, you have the mental component that you're going to pass away. Probably more painful is severe burns, and extreme pain, tight tissues, continued discomfort because of nerve endings firing, adding dehydration, and just that uncomfortability. Why do some people like myself have flat feet and some have arched feet? Is it true having flat feet is a medical deformity?
What did you say?
Okay, arches. They are developed as we're young, tendons and ligaments are formed, and the arch forms. Some people during this developmental stage do not form that big arch during that time period. Is it necessarily a medical deformity? No, it is just a structural difference that an individual may have. Sometimes it can cause chronic pain, while other times it's totally fine. People have flat feet and there's no pain. Even professional athletes could have flat feet. Back in the day, during like World War I, World War II time, people were medically discharged from the military with flat feet out of concern of chronic pain and inability to have long-term endurance because of their feet structure. But the US military does not disqualify anybody anymore for having flat feet. What happens if someone without diabetes takes insulin? Is it lethal, or what happens to the body?
This is bad.
The job of insulin is to reduce blood sugar in our body. So people who do not need it produce their own insulin. So if you're injecting insulin into your body when you already produce enough, what could happen? You're just going to have an excess amount of insulin in your body, which will then potentially plummet your blood sugar, causing hypoglycemia. And when people's blood sugar goes below 60, 50, getting into 40s and 30s, you become altered, confused, sweaty. Seizure activity can happen. You might be in a coma. You can even actually die. So just so you're all aware, insulin is a high-risk medication, and so that does increase the risk of death if used inappropriate. So we really have to watch our units, how much we're giving, how much somebody is getting, because when there is an accident, we need to give them as much sugar as humanly possible. There may not be enough sugar that you can give somebody, literally, if they've taken way too much insulin. Is it true that sleep helps your brain get rid of waste?
Did you sleep okay last night?
Great.
I got a full 40 minutes.
Yes. During deep sleep, your brain has a system called the lymphatic system. I'm not making this up. And it helps clear out the waste. It's basically your CSF going around in your brain while you're in deep sleep and getting rid of metabolic waste, amyloid, beta, and tau proteins, which have been linked to Alzheimer's. And so your body gets rid of this and clears it. Very cool. So you do need deep sleep to be able to clear this out. So if you're having difficulty sleeping or you want to make sure that your brain is optimized, to check out Do Not Disturb by my company Life Happens. It's a doctor formulated melatonin free to help you drift into deep restorative sleep. If you're interested in it, definitely check it out at lifehappens.com or on Amazon. I've heard of black lung, but does blue lung exist?
What did you say?
Actually, it's not an official diagnosis, but historically there have been a couple scenarios where people's lungs could be blue, and one would be from pneumoconicosis, from slate miners, or asbestos-related lung issues because the lungs would get like a blue hue. But there was also farmers that dealt with silos because silos had high concentrations of nitrogen dioxide in there, which then would cause somebody to turn blue. The real terms relating to it are pneumoconicosis, asbestos-related lung damage, relating to mostly the cause, not what we see. How long should I stay in a fallout shelter after a nuclear war in order to be able to breathe and not get radiation sickness, etc.? So this is a broad answer because so many factors come into play. But the dangers come from radioactive fallout particles that are left on the ground or in the environment thereafter. Radiation levels drop over time. So there's something called the 7-10 rule, where for every 7 hours, typically there's a 10-fold reduction in radiation levels. They do recommend staying maybe in the shelter or have food up to 2 weeks. Coming out too soon increases your risk of radiation exposure, and you might get symptoms of nausea, vomiting, headache, weakness, coma. You might even get full immune collapse. Your immune system may not even function. It might actually kill all of your bone marrow and white blood cells. What happened to that cloned sheep Dolly in the 90s? Have they done other cloning like humans?
Dots mean she's been cloned 4 times.
Dolly was cloned in 1996. It was the first mammal to be cloned from an adult cell. And Dolly ended up living half the normal lifespan of a sheep due to lung disease and arthritis. And scientists were not sure if that was related to the cloning process or just really bad luck. Since then, other animals have been cloned. Cows, dogs, monkeys, but no humans. Not that we know of.
I'm going to the island.
There is no island!
Due to ethical and legal reasons, humans haven't been cloned that we know of, but we do other therapeutics relating to it, like growing skin. Do you think we should clone humans? Let me know in the comments. These questions are great. Keep them coming. They're thought-provoking, helpful for everybody. So definitely keep sending them our way. And as always, do me a favor and don't forget to subscribe. We need to continue to grow. And do me a favor, turn on your bell notifications and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.